Today we are going to destroy the narcotics that are in our unit that have been approved for destruction.
These are all from criminal cases. The cases have been adjudicated in court, and we have a court order from the PA's office, municipal or Boone County, stating that we can destroy these items. We have about possibly 100 pounds of drugs to destroy.
We also have drugs that are taken during other types of investigations, whether they be death investigations, things like that. We'll actually seize those narcotics so they don't end up out on the street. We're going to use the Drug Terminator, which has been given to us by the health department. We had asked them previously if they would help us in acquiring one. It's about $5,000 after it's all said and done.
We purchased it with leftover money from our 2012 budget. And really what we had in mind was utilizing this to promote our prescription drop box program, as well as impacting our community identified strategic issue areas. There was one issue area that was really representative of behavioral health, and we thought this was a great way to impact that strategic issue area.
The Drug Terminator is actually kind of like a BBQ Pit on steroids. We're going to load it with about 10 pounds of charcoal, throw a piece of burning paper in there and turn it on, and that's the ignition system.
The Drug Terminator gets somewhere around 1,500 degrees. By permit, we're required to burn in excess of 1,100 degrees. When we put the narcotics into the Drug Terminator, it actually burns them down to roughly somewhere between 1% and 10% of its original size. It reduces it to absolute ash. There's no other toxins or anything left in it. They've all burned out. Because of the heat at which it's burned, the toxic levels of what we're burning are gone. Those are no longer an issue. That's why they require it burn at 1,100 degrees.
The health department provided the police department a drug take-back drop box, and so we have that in our lobby, and people come in and they dispose of their unwanted drugs. Pharmaceuticals, over-the-counters, we end up with all of it. We actually have those items seized and placed into our evidence unit, and once they're there for a period of time, we're able to destroy those under the same guidelines as the rest of the drugs that come into our unit.
We try to dispose of these about once a month. We don't like them in our department any longer than we have to have them.
There's not a requirement on when we have to destroy them. We do it by space. So once we get to a certain level, Michelle will come to me and say, let's destroy, and we'll schedule a date and come out here and take care of it. So ours is more space driven than anything else. A lot of agencies will actually do either a space requirement or they'll do a every 2 weeks or something like that. This is a full day venture for my evidence unit.
Overall, and especially in the past year, we've put a lot of emphasis on creating community partnerships. And it's particularly important to involve community partners in our planning process because we realize that health impacts all aspects of someone's life. So this partnership with the Columbia Police Department is especially important because it allows us to get drugs out of the hands of people who don't need them, allows people to be safe and then dispose of them safely. So they're out there promoting overall health in the community.